Strokes can cause a variety of symptoms. Often we train our patients to recognize just a few simple symptoms that may indicate a patient is having a stroke. One is facial weakness. That's what the F stands for in the FAST acronym. Facial weakness. So you can ask a patient to smile. If they smile and they have weakness of one side of their face, that may indicate that the patient's having a stroke. The A stands for arm. Have the patient hold up their arms. If they can hold up their arms and they're not weak, or if one arm drifts down or it's weak, that may be a sign of a stroke. If you notice any weakness in the leg as well. The S stands for speech. Speech is often affected in patients who have stroke. Either they can't understand, they're not speaking correctly, or their words are slurred. The T stands for time. Time is critical. Patients that have strokes need to be treated immediately. And so if you suspect somebody's having a stroke, it's very imperative that you call 911 and get that patient immediately to the hospital. TPA is a medication that has really changed the way we treat strokes. The majority of strokes are caused by lack of blood flow to the brain. We call those ischemic strokes. TPA is a medication that breaks up blood clots. Most often, strokes are caused by a blood clot in one of the arteries that's preventing blood flow to the brain. TPA works by breaking up that blood clot and hopefully restoring blood flow to that part of the brain. Well, the golden hour is a term that we often use here in the emergency department. It indicates that from the time a patient arrives through the door to the time they are treated with TPA, we like that to be in less than an hour. To properly evaluate a patient, there are certain things that we need to do to determine whether or not they've had a stroke and whether or not they're a candidate for TPA. It's very imperative that we do that within 1 hour time frame, and that's why we've implemented the telemedicine program throughout all of the Health One hospitals in the Metro Denver area to make sure that all of the patients, all of the hospitals can fulfill that criteria of treating patients with TPA within 1 hour. Stroke is primarily caused by a blood clot to the brain. The main risk factors for stroke are some of the same risk factors for heart disease. So we think of high blood pressure. High blood pressure is one of the biggest risk factors for strokes. Diabetes, particularly poorly controlled diabetes. High cholesterol, cholesterol that is not treated with medications and is out of control. Smoking is a big risk factor for strokes. Obesity is also a risk factor for stroke. There are certain less common things, but those are the majority of the risk factors for stroke.